Huwag ka na mo. Buenos dias, Zamboanga. Welcome sa Kapihan na Zamboanga COVID-19 update. We are live via PIA Western Mindanao Facebook page, One TV Philippines and other partner agencies' Facebook pages, and via cable televisions at MCTV and eMedia. Kukumustahin po natin ang ating COVID-19 cases and vaccination status sa buong Zamboanga Peninsula kasama po ang Department of Health Region 9. We have with us today Dr. Mary Germaine Punsalan. Magandang araw, Doc.
Good morning po, ma'am. Good morning po sa lahat ng nanonood sa Kapihan natin ngayon.
Of course, I know curious po yung ating manonood. Kumusta na po ba yung ating kaso po ng COVID-19 cases sa buong Zampen and yung ating vaccination program po?
Yeah, actually, ma'am, no, we've been seeing minimal cases po in the past few weeks. Generally speaking, yung Region 9 po ay nasa low MGCQ pa rin, together with Zamboanga del Norte and Zamboanga City. However, for the province of Zamboanga del Sur, Sibugay, and Isabela City, they are classified under the minimal new normal. But still, no, generally speaking, these are very minor number of cases that we've been seeing in the past few weeks. And on top of that, yung ating ADAR o yung average daily attack rate for the region is at 0.12. And if we compare it to the data natin last year, this is actually lesser compared to the data, the ADAR natin last year. So as of June 14 po, kung makikita niyo po sa slides natin, we actually have 42 active cases. And this sums up to a total of 6,368 cases in the whole Zamboanga Peninsula. And 57,780 tagged as recovered, while 2,546 individuals died from the COVID-19.
Okay. It's good to hear.
In terms naman din po of our... Yes.
Opo. It's good to hear po, Doc, na mababa na lang din yung ating confirmed cases po, positive cases ngayon sa buong Zampen. And how about po yung ating vaccination program? Kumusta po yung ating status?
Yeah, in terms naman din po of the vaccination program, up to 20, our country was already able to hit the 70 million mark of fully vaccinated individuals. So magandang milestone and achievement po yun ng buong bansa. For Region 9 naman po, Zamboanga Peninsula, actually if you total up the number of fully vaccinated individuals po dyan sa slides po natin, we are already at 2.2 million fully vaccinated individuals, and this is 71.43%. We also reached our target of at least 70% for the whole region. And if you take a look at the next slide din po, this is the coverage of our children, 5 to 11 years old and 12 to 17 years old. So kung mapansin nyo po, as of June 19, we have already vaccinated 144,000 5 to 11 years old children in the whole Region 9. And this accounts to 25% ng ating target population na around 500,000 na 5 to 11. Yung sa 12 to 17 years old naman din po natin, we are able to fully vaccinate already 76% ng ating target population of our 12 to 17 years old.
Okay. Thank you very much, Doc, sa ating update on our vaccination program. Doc, meron ba tayong mga bagong COVID-19 variant na na-record dito sa Zampen?
Actually, ma'am, the most recent COVID variant, well, it's not in Zamboanga Peninsula, no. It's actually in the country. So sa country natin, yung most recent was the BA.5, which is actually a sub-variant of the Omicron. So, sa Zamboanga Peninsula naman, we have not recorded any new variants of interest, particularly yung mga new sub-variants po ng ating Omicron.
Okay. That's good to hear again po, Doc, no? Doc, are we still observing po ba yung ating minimum public health standards so far po sa mga monitoring natin?
Yes, actually, one of the most distinguishing features ng MPHS natin is really on the wearing of our face mask. So we still are seeing establishments implementing this rule. However, yung napapansin lang po talaga is on the social physical distancing, no, minsan nakakaligtaan na po ito. That's why we need to continue to reinforce our MPHS and so that we can prevent, no, yung further should there be any increase or surge of the COVID cases.
Doc, you mentioned on the use of face mask. Do you think ba is it still appropriate? Kailangan pa po ba ito wearing face mask na voluntary or pwedeng voluntarily na lang like other region po or other cities na nagpa-practice na voluntary na lang yung wearing of face mask? Malapit na po ba itong mangyari dito sa Zampen?
Yeah, actually, Ma'am Myra, we are still waiting official guidance coming from our central office and even coming from I think this. But I would just like to reiterate lang din po, no, na yung Pilipinas po kasi it's one of the highest masking, we call them masking countries, no, na a lot of us, a majority of us rather in this country are wearing masks. And if you look back, no, sa ating pandemic response, yung pagiging high masking country natin actually is a cost-effective measure, no, compared to those na yung compared na i-test lahat. So very 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 proven strategy po yung masking. So as of now, while we are still waiting po for the guidelines or the guidance coming from our interagency task force, we continue po to implement muna yung pagsusuot ng we are in an enclosed space or kahit po sa outdoor din po, no, especially if we are with other people outdoors. So we still continue to reiterate the usage of face masks.
Yes. Especially po sa ating mga kabataan, yung ating mga children po, no, na hindi pa nababakunahan or vulnerable din sa COVID-19. Speaking of sa ating mga children, Doc, kumusta yung status ng ating vaccination for the children? And how about naman po yung mga children below 5 years old? Do we have vaccination for them?
Yeah. Actually, ma'am, wala pa po tayong vaccines available for less than 5 years old. But for the 5 to 11 years old naman, if you take a look at the slides po again, if you total it, nasa 144,000 na po, no, both yung with comorbidities na 5 to 11 as well as the rest of the pedia population na 5 to 11 years old. And itong 144,000, this is 25% already of our projected population for the 5 to 11 years old. And initially po, no, we have actually been primed by the National Vaccine Operations Center na nung sa simula po ng I think it was in May or the last few weeks of May, we were informed that yun na po yung last batch ng pedia orange caps na matatanggap ng Region 9. But apparently we have been given again additional batches, no, of pedia Pfizer orange caps. So we are actually expecting 70,000 more doses of our orange caps, which we will be allocating to the different provinces and cities of Region 9. And yung maganda po talaga na coverage natin is if you can take a look at the slide, yung ating 12 to 17 years old, nasa 76% na po ng ating 12 to 17 ang fully vaccinated. And this amounts to a total of 349,000 fully vaccinated individuals.
So far po, maganda rin po yung ating improvement, no, sa ating vaccination program within terms sa ating 12 to 17 years old and yung sa ating pediatric vaccination. Doc, are the vaccination sites po now accepting walk-in clients for our second dose or second booster dose natin?
Yeah. Actually, ma'am, a lot of our vaccination sites right now are already accepting walk-in clients. No? Hindi na po kailangan ang mag-master list. And in reference to the second boosters po, since our rollout for the second booster is still limited to our frontline healthcare workers, no, yung mga nagtatrabaho sa hospitals, sa TTMF, sa mga RHUs, and even those those working, no, in closed institution settings like orphanages, mga home for the elderly, yun as they are still tagged as A1, and anytime lang po they can go and get their second boosters. For our senior citizens naman po, ganun din po yung situation. If they are already done with their first booster, yung minimum interval natin is 4 months man from the first booster. So they can just go to any vaccination site and have themselves vaccinated. Immunocompromised A3 or adult with comorbidity, particularly ito po yung mga taong diagnosed with HIV, undergoing steroid treatment, nagkaroon ng transplant, those diagnosed as well with cancer, autoimmune diseases. So sila po yung under immunocompromised A3. Sila din po ay pwede na rin kumuha ng kanilang second booster.
So i-clarify lang po natin, Doc, na ito pa lang yung mga nabanggit nyo pong priority groups ang pwedeng makakuha ng second booster and they can visit any vaccination sites po for walk-in.
Correct po, ma'am. They
Okay.
just have to present their valid ID as well as their vaccination card, signifying that they have already completed their primary and their first booster.
Okay. So yun po, no. Meron po ba tayong target date kung kailan natin bubuksan yung ating second booster dose for the rest of the priority groups natin?
The National Vaccine Operations Center still hasn't provided the target date for the general population rollout of second booster. We're still awaiting our Health Technology Assessment Council. And also, we're still waiting for additional evidences to support the rollout for the general population. So, ang advice lang po namin sa lahat, hintay-hintay lang po tayo hanggang sa mabigyan na po tayo ng sufficient na data or datos para will guide our policy makers that we can now start our rollout for the general population.
Okay. Thank you, Doc. Doc, sa mga na-record po ba natin, ilan na po yung nakapag-receive or nakapag-second booster dose? And so far, meron po ba tayong na-report na serious adverse effects?
Yeah, actually, before I proceed with the second booster, gusto ko lang din po i-highlight yung first booster, no? Kasi currently, in the region, we were only able to provide 355,000 first boosters, no? Out of the eligible 1.7 million dapat na mabigyan ng booster 18 years old and above. And that's just 21% no ng ating 1.7 million. Of those that were already provided with the first booster, since our rollout is limited only to A1, A2 and immunocompromised A3, sila po ay around 5,335 individuals na po in the whole Region 9. And however, itong 5,330 out of the 389,000 na mga A1, A2 and immunocompromised A3 na dapat mabakuna natin ang kanilang second booster. To date din po, no, ma'am, wala naman din po tayong na-record na serious adverse event following immunization, especially after their second booster vaccination. Usually po, yung mga symptoms lang of fever, muscle pain or myalgia or body weakness, tsaka yung pain on the injection site, yun lang po yung usual na nare-record natin na adverse event following immunization.
Okay, nabanggit po ninyo na medyo mababa pa rin nga po yung ating first booster, no, yung primary booster natin na record so far. We have already 20% pa lang. So, ano po yung strategies and methods ng Department of Health, especially with the LGUs, na para po ma-monitor o ma-increase yung ating pag-encourage sa ating mga residents to get their booster shots?
Well, one thing that we can really do right now is to make them understand the need for the booster. Because wala pong policies in the pipeline po, no, na signifying that required ang first booster sa lahat ng mga tao. But seeing the evidence, no, that we have right now na pag tayo ay nakakomplete ng ating first and second dose and to add to that the booster dose, we see an improvement, no, there when it comes to COVID-19. So, yun lang po, no, alam ko it has been the clamor of our implementing units na dapat gawing gawing ordinance or ilagay siya sa ating guidelines and law that we should require the first booster. But seeing as our policymakers no sa IATF and even from the National Vaccine Operations Center have not yet included this, no, what we can really do on our end is to intensify our social mobilization activities. We talk to people, have them understand the need for booster. And kung tayo po mismo ay nakapag-booster na rin, we share to them our experiences of having the booster vaccines as well. So yun po, ma'am.
So yun po, we encourage everyone no sa mga nakapag-booster shot na, encourage all your colleagues, friends, and relatives also to take the booster shot. As what mentioned po ni Doc Jem, na this really helps po para po ma-decrease nga or maiwasan yung pagkalat ng ating COVID-19 cases dito sa Zampen. Doc, with that, ano yung ways forward ng Department of Health, especially in monitoring po yung ating institutions, establishments, in complying po sa ating minimum public health standards?
Yes, we are continuously in collaboration with other government agencies po, no? Especially in the implementation of our BIDA solution. And just to, actually, no, yung BIDA solution natin, hindi lang siya the usual BIDA natin na bawal walang mask, that isanitize dapat ang kamay, dumistansya ng 1 metro, and alamin ang tamang informasyon. Yung bagong BIDA solution natin na sinishare na sa lahat ay, una, is the best fitted mask. So, kailangan po na nakatakip ng maayos, tapos yung mask natin ay nako-cover ng significant portion po no, na covering our nose and our mouth. Yung isang eye sa ating bagong BIDA solution is isolate pag may simptomas. So, pag sa opisina po natin, meron po tayong mga colleagues no, that are already exhibiting symptoms like cough and colds, we advise them to isolate already. And then, yung D natin is we double up our protection with primary doses and our booster doses. And yung A is airflow. Ensure po talaga natin na maganda yung airflow natin sa ating opisina, sa ating paaralan, and even no, sa ating mga public institutions, no, so that we can be protected against COVID-19.
Ayan. Thank you very much po once again, Doc Jem, sa pagpapaalala, reminder sa ating publiko. Doc, any more closing message po, announcements from Department of Health?
Yeah, actually, aside from the COVID-19 response that we have been doing no, since the start of 2020, we are very much privileged to have significant support no, even from private stakeholders no, in intensifying our laboratory network and also capacitating our COVID-19 lab here in the region. And on top of that, no, we also want to remind everyone about our BIDA reminders. Please don't forget to continuously follow our BIDA reminders. And additional announcement lang din po, actually this coming June 23 and 24 will be the phase 3 of our ticketing vaccination day. So, kung meron po tayong bakuna sa mga adults no, for COVID, one of the programs na nakakaligtaan talaga ng ating mga implementing unit or mga RHUs is our vaccination for children, no, to protect them against vaccine-preventable diseases like measles, mumps, rubella, diphtheria, ang dami-dami po, pertussis, tetanus, and the like. So, that's why this June 23 and 24, we urge no yung mga nanay natin na pag hindi pa po nakumpleto yung bakuna ng mga anak natin, dalhin po natin sila sa ating pinakamalapit na health center. And on top of that, June po is Dengue Awareness Month. So, we continue to remind everyone sa ating 4S, no, the search and destroy, self-protect, no, yung mga sarili natin, and then secure early consult kung meron na po tayong mga signs and symptoms, no, like fever, especially pertaining to dengue. And then, the last S is support fogging, especially during outbreak. And this is particularly true for Zamboanga City, no. So, yun lang po yung mga reminders po namin from the Department of Health.
Ayun. Thank you po. Although priority natin pa rin yung ating COVID-19, but of course, meron din tayong ibang diseases na minomonitor. So again po, on June 23 to 24, chikiting vaccination po. Dalhin po yung ating mga anak, mga bata po para para to get their vaccination or other vaccines po aside from the COVID-19 vaccines. And of course, yung ating pag-monitor rin ng ating surroundings so that maiwasan natin yung ating dengue outbreak. Thank you very much po once again, Dr. Mary Germaine Punzalan of Department of Health Region 9. Thank you po, and magkita po tayo sa susunod pa po nating COVID-19 update. Ayun. Thank you very much. And once again, thank you very much din po sa lahat ng ating manonood ngayong araw. Magkita-kita tayo sa susunod na Kapihan na Zamboanga. Ito si Mayra Espinosa. Muchísimas gracias. Janet Vidao a ustedes.